Seniors, what's the best blood pressure for older adults? Know the truth. Recent medical breakthroughs are completely rewriting the rules on aging and cardiovascular health. For decades, the medical community has operated under a single, rigid mandate. The ideal blood pressure is 120/80, and lower is always better. However, brand new research published in the Journal of the American Medical Association, JAMA, has revealed a shocking truth that every person over 65 needs to hear. Aiming for that perfect 120/80 target can actually be a death sentence for seniors, leading to a catastrophic cascade of dizziness, falls, fractured hips, and a rapid decline in independence. You won't want to miss the final habit regarding the lying to standing test, or 99% of seniors will miss the last tip and will remain stuck with dangerous hidden blood pressure drops that could lead to a life-altering fall tonight. The tragedy of traditional blood pressure management in older adults is best illustrated by the hidden dangers of over-medication. When a senior's body is forced to hit a middle-aged target of 120/80, it often lacks the perfusion pressure necessary to push blood upward against gravity to the brain. Unlike the flexible elastic arteries of a 30-year-old, senior arteries naturally stiffen, a process called arteriosclerosis. This means an older body actually requires a slightly higher pressure to ensure that vital organs, especially the brain and kidneys, receive a steady supply of oxygen-rich blood. When we artificially suppress this pressure with multiple medications, we aren't just lowering a number. We are starving the brain, which leads to the fog, fatigue, and dangerous instability that many mistake for simple old age. The mechanics of why 120/80 fails seniors involve a critical internal sensor system called baroreceptors. In younger people, these sensors react instantly when you stand up, signaling the heart to beat faster and blood vessels to constrict to maintain pressure. As we age, these sensors become sluggish. If your resting blood pressure is already aggressively low due to medication, and your baroreceptors are slow to react, your pressure will plummet the moment you stand up. This condition, known as orthostatic hypotension, is the primary cause of the sudden, room-spinning dizziness that leads to thousands of hip fractures every year. For a senior, a broken hip is not just a bone injury, it is a high-risk event that frequently leads to a permanent loss of mobility and, tragically, secondary infections like pneumonia. Current real-world data following 15,000 adults over the age of 75 suggests that the sweet spot for longevity and quality of life is actually significantly higher than previously thought. The research indicates that seniors with a systolic top number between 130 and 140 actually had the lowest mortality rates. This slightly higher pressure provides a safety buffer, preventing the brain from being starved of blood during position changes. Conversely, those pushed below 120 saw a spike in acute kidney injury and syncope, fainting. We must shift our focus from achieving a textbook number to maintaining functional vitality. If a blood pressure goal makes you too tired to walk or too dizzy to stand, that goal is medically inappropriate for your specific stage of life. The ideal target is not a one-size-fits-all number. It must be individualized based on your frailty status and medical history. For healthy active adults between 65 and 75, a target of 130-140 systolic is often ideal. However, for those over 85 or those considered frail, a target of 140-150 systolic may actually be the safest choice to prioritize fall prevention over theoretical long-term heart risks. Furthermore, the diastolic bottom number should ideally stay above 65 or 70 to ensure the heart muscle itself receives enough blood during its relaxation phase. Understanding these nuances allows you to work with your doctor to treat the person, not just the pressure gauge, ensuring you stay active and independent for years to come. To truly take control of your health, you must implement the home orthostatic protocol. This involves more than just checking your pressure while sitting comfortably. You must check it while lying down and then immediately check it again after standing up. If your top number drops by more than 20 points, your medication is likely too aggressive, regardless of what the initial reading says. This hidden drop is the silent predator of senior health. Bring this data to your doctor and have a courageous conversation about adjusting your targets to reflect your unique physiology. Reclaiming your stability is the first step toward a long, dignified life where you move with confidence rather than fear. Subscribe to stay informed on the latest medical truths for senior health and longevity.